Welcome to the second day of the IFRC General Assembly, where discussions are ongoing to set the vision, strategy, and policies that guide our movement, uniting our national societies around the world. In our session now, we have here Alexander Matthew, the IFRC Regional Director for Asia Pacific, to talk about the humanitarian crisis happening in Afghanistan. Good morning in Geneva, Alexander, or I think it's already afternoon.
Good afternoon, Afro.
Alexander, you have been to Afghanistan recently, and you always make sure that you go back to make sure that we know what's going on the ground and what the IFRC is doing there overall. Can you provide us an update on the overall humanitarian situation there, and what are the urgent needs that you have seen so far?
Well, in my most recent visits, I was in the south of Afghanistan in Kandahar, and looking at the particular vulnerabilities of people who have recently returned from Pakistan to Afghanistan. And many of those who have done so, there's approximately 500,000 of them, came with very, very little. And they were amongst the poorest people in Pakistan anyway. And when they arrived, they were in need of all the basics of food, immediate medical care, and then the long-term challenge of where they were going to live and how they were going to have a livelihood. Often building a life in a country that they haven't actually been in, or if they were there decades ago. But what it enabled us to understand, just seeing the people who had recently arrived, is not only their extreme vulnerability, but how difficult it is for a host population to receive 500,000 people in a relatively short period of time, in terms of medical capacities, hospital facilities, inoculation campaigns, and the ability of host families to receive people, because they're already poor, and now they're sharing the little they had with 5, 6 more people. The cases of severe malnutrition amongst the children were very high, and that was visible just from the people that we met, but it was also reported from the hospitals. That was the particular issue that I was looking at. But if we're talking about vulnerability in Afghanistan more broadly, we could look at it from multiple angles. It's chronically vulnerable because of 40 years of lack of development and conflict. It's also vulnerable to climate risks, and people who are already poor find themselves impoverished by flooding or earthquakes. And it has some of the poorest facilities for medical care in the world. You combine all of these factors, and you are talking about one of the biggest humanitarian crises in the world today, which sadly has been true actually for a long time.
Yeah, so Afghanistan has been sadly crisis-riddled in the past years and decades as well. Alexander, you mentioned quite a number of things about the security of the health situation there. How has the access to healthcare evolved in Afghanistan, especially in remote areas? And I believe Kandahar is considered a very remote area in Afghanistan.
Well, it's a long chronic problem, as I mentioned, that health facilities are largely inadequate, particularly in the countryside. And people have to travel long distances to get even primary healthcare. It has been supported over the years by international financing, by development financing, by humanitarian organizations, by various governments in Afghanistan itself. But no one has ever achieved anything like a suitable availability for the rural population at large. It was particularly hit after August 2021, when much of the international financing was withdrawn, which brought many of these health facilities to a close. Then humanitarian financing temporarily began to prop them up again, but that financing is now reduced, and therefore payment of doctors and nurses, the availability of medicines, certainly modern equipment, all of them are totally inadequate for the needs.
Thank you for that. Indeed, it's a very dire situation that we have in Afghanistan at the moment. You were also mentioning about financing, but we will get to that in a few. But right now, I want to pick your brains as well in terms of how can you describe the overall state of food insecurity in Afghanistan and how many people are facing a malnutrition. In fact, the IFRC just launched a disaster response emergency fund last week, seeking 500,000 Swiss francs to address the malnutrition issue. Can you tell us more about that?
Which is, of course, not enough, but the situation is so desperate that we felt we should do at least as much as we can. So, as you say, we released our draft that will reach 45,000 children and provide them with feeding. The Situation at large in terms of how many people are in need of assistance, around 23 to 25 million people in the country at large. The number of people experiencing malnutrition, around 10% of the population. More than that if it's specifically around children. So large numbers. Severe acute malnutrition, I'm not sure we've got a full figure, but what we are seeing is that in the health clinics of the Afghan Red Crescent and in the government's health facilities, the number of children coming into hospital who are suffering from severe acute malnutrition is on the rise. It was even evident when I was there in Kandahar. You can see it just by looking at the children, which is why it is important to have these therapeutic feeding programs. They are not a long-term strategy at all. They are an emergency measure to save lives. Ultimately, there needs to be a longer development approach to access to clean water and sanitation, support for pregnant and lactating women, and livelihoods so people have enough income to have enough food to feed their children.
Okay. Yes, I think just like with any other major humanitarian crisis, it's obvious that women and children are being affected differently. How is the Red Cross supporting women, children, and other vulnerable groups who are disproportionately affected by this ongoing crisis?
We have a particular program to support destitute women. It's an old program, it's called the Marastun program, where we try to provide shelter and livelihood support and education for children for women who have essentially been made destitute, either because they have lost, largely because they've lost their husbands or lost the breadwinner in the family. It's, I think, an important program because it's not short-term in what it's trying to achieve. It's not just providing short-term feeding. It provides shelter for a number of years and livelihood training for a number of years in the hope that women will be economically independent and able to look after themselves. The challenge is that the number of people in need of that assistance is far greater than what the number we're able to provide shelter for in the various Marastun facilities across Afghanistan. Therefore, we hope very much it's going to be possible to scale that program up. But that is our particular intervention that we focus on.
Thank you so much, Alexander. Before we wrap this up, I would just like to share as well that in terms of the overall IFRC response, and I know that the IFRC leadership in Asia Pacific, especially you, has been very vocal about the support that Afghanistan needs. In the past year, you have published 3 op-eds in the New Humanitarian, on DevEx, and Al Jazeera as well. And in terms of our ongoing emergency appeal, the IFRC Secretariat funding requirement is seeking 120 million Swiss francs. And we have done a lot. So far, we have reached 675,000 people on healthcare services, 500,000 people on livelihood support, but it will never be enough. And what do you think in terms of the current level of funding? Do you think it will be sufficient to meet the growing humanitarian needs in Afghanistan? What can we do about it if it's not happening at all?
Well, there is definitely a shortfall of humanitarian financing in terms of the number of people that humanitarian agencies, including the IFRC and the Afghan Red Crescent, would want to reach and are planning to reach. Every agency is not receiving enough to fulfill the plans that they have. But that's in some ways a simple answer to a much more complex question. In reality, it's not realistic to expect endless amounts of humanitarian financing for the same country year in, year out. Inevitably, donor fatigue enters, as it has done in Afghanistan. Other crises dominate the headlines, distracting financing from contexts like Afghanistan. And ultimately, no country wants to be dependent on aid forever. So the 2 things that would need to happen that would enable us to move on from where we are now, which is constant shortfalls of humanitarian financing, are firstly, it's good to help organizations like the Afghan Red Crescent to generate its own income so it can run its own programs and be less reliant on international aid. That may sound idealistic, but it's not impossible. Around 25% of the financing of the Afghan Red Crescent is raised domestically. So the more you can push that, the less dependence you have on international financing. Secondly, ultimately, it's a political crisis with a deadlock in international diplomacy, which prevents the possibility of trade and development investment. that needs to be resolved. I understand it's extremely complex, but the only way you're going to break dependence on humanitarian aid is to resolve that diplomatic deadlock. So if that is resolved, and if the financing is more around the resilience and economic independence of the local humanitarian organizations, then it is possible to break that cycle which we're in now. The cycle we're in now is that, yes, there are a lot of people in need, a lot of agencies that could do more but can't do more because there's not enough money.
Thank you, Alexander. That's very insightful. And this is actually also one of the topics that we are trying to discuss and tackle here in the ongoing meetings here in Geneva this week until the end of next week. So thank you to our audience who joined us on our live session today. Thank you, Alexander,
much,
for your
Avril.
time. I'm Afril Rances, the Regional Communications Manager for IFRC Asia Pacific. Thanking you all for joining us today.
Thank you.